with every treatment, we're always looking for, are there joint restrictions in a certain area that need to be worked through so the ankle can still function better and move better. So we assess from the toes to make sure that they are moving, and each individual metatarsal there, and then we're going to work through the tarsals themselves up in here, like the small little bones. So again, calcaneus, talus, navicular, the three cuneiforms, and the cuboid bone over here. I want to make sure that they have their motion that they're supposed to as well. It shouldn't feel like a hard end feel when they're being assessed. They should give a little bit. If they don't, they'll thrust to that joint to help that move better. After we've gone through a round of instrument-assisted soft tissue work, or if we're doing dry needling, we'll do that as well for very acute cases to get that swelling to go down. I utilize end range isometric contractions of the ankle, which we know it's not a ligament that's actually contracting, but it is getting that stimulus when the muscles are pulling into a different position that they're stimulating as well. So we are going to do it in a couple of different positions. Sometimes if it's an inversion ankle sprain, we'll go into inversion and have the patient try to meet that resistance and pull the opposite direction. So if I'm holding here, I'm going to have her try to contract all of this tissue here to shorten, but I'm going to not allow her to. That is called an isometric contraction, meaning that the tissue gets to a length, we put a contraction in there, and it's not moving. The nice thing when you have an acute injury is isometric contractions don't create new inflammation. They don't create more heat because there's nothing sliding there. Go ahead and relax. The beauty with isometric contractions is you can do them in different positions and get another stimulus. So we just did a very long position. Now we'll go halfway. I'll just say, don't push me out and around, but I won't allow her to move through her ankle. Okay, go ahead and relax. We could even go up higher. Now push me out. Now again, that's just stimulus to the tissue itself. And relax. Now take it all the way here. Don't let me move you. Now it's as shortened as she can get, and then I'm creating a stimulus where she has to hold that tissue. If there's a weakness in any of those one positions, we'll start to target that more and more to make sure that it can hold in different positions. Because when we go out in the real world, not everything is flat. We have curbs, we have grass, we have sand, we have, depending on the person, they may walk in flat surfaces all day and then once have to step on a rock and not be prepared for a different position. So we try to allow the rehab to make it so you're actually more resilient than when you came in or before you even got injured. So again, this is the initial point with treatment for an ankle sprain. Dependent on the severity is going to depend on how much we actually need to do manual care prior to doing active care, exercises, rehab, that type of stuff. In our office, we don't just say this is a 12-week protocol for an ankle sprain. It's like we have to understand that things are going to improve in some people quicker than others, that you're going to heal as quick as you can if you have a healthy environment to do so. So we also add in good supplementation, good nutrition. That doesn't mean that you have to go out and buy all the new things in the world for here's all these supplements and pills. But if you're eating a healthy diet, it's going to help create a healthy environment internally. Now we are trying to improve the environment externally via exercises, rehabs, strengthening, so this does not happen again, or it does not happen as severely ever again. There you go. So again, I'm Dr. Bird. Hopefully you enjoy watching this. I know that was a bit much on the education on that, but it's important to understand what we are looking for an ankle sprain and how to rehab it best. Thanks for watching.